Hi everybody. I am hanging out in the parking lot of my eye doctor's office waiting for them to open because I have put off this appointment entirely too long, and so I am equally bad about that as every other mom I think in the world. But then I realized that I didn't do a video last week, and this week isn't looking pretty either, so I'm going to use the time I have. Let's talk for a minute about the difference between the emergency room, your urgent care, and your doctor's office, and when I want you to use each one, because we have issues. So here's the deal. Emergency rooms are the gateway to the hospital. Unless you have a scheduled surgery, you are probably going to get admitted through the emergency room, okay? Go to the emergency room if you think that you need to be admitted to the hospital, or if you need a surgeon. So grown-ups, chest pain, shortness of breath, stroke symptoms, probably should go to the emergency room. Little kids who are having trouble breathing, little kids who are having seizures. I've seen some stuff, and we're just going to say that sometimes that happens. Please don't go to urgent care. Urgent care is going to freak out. Don't do that. And please don't wait to see your doctor. In newborns with a fever, emergency room. Don't play. Just go. Trust me, your insurance company will pay for it. If you know it's broken, like, your arm bends in a place it didn't used to bend, that's kind of a clue it's broken. Or if there's like bone sticking out, you should go to the emergency room, because those are the guys who can fix those sorts of things. So then, what is urgent care? Urgent care was made to fill a need for care at weird hours when your doctor's office is not open. Because I love you all, but I am not willing to stay at work 24/7 to, forgive me, I'm trying to also fight with the sun, to, hang out until you guys get sick. That's just not realistic. So we can't be open 24 hours a day. Urgent care provides the care that you need that can't wait for me. Good reasons to go to urgent care. If you need stitches. If you think it's sprained, probably not broken, but you just want somebody to check and make sure, that's an urgent care trip. If you are sick, like, 105 fever, white junk on your tonsils, you're pretty sure you have strep, and your doctor can't get you in for 5 days, that's a reasonable urgent care visit. If you're in so much pain that you can't realistically wait for urgent care, or for your doctor's office, that could be an urgent care visit. So what does that mean for your doctor's office? It really means that most illnesses and conditions you have should be seen at your primary care doctor, not in an urgent care. If, in general, you have had it for more than 3 to 5 days, please don't go to urgent care, because they're just going to think that you're insane, frankly. You'll get the question, so what brings you in today? And that is urgent care and emergency room code for, dude, you've had this for a week. Why are you here now? Why are you not in your doctor's office? That's what that actually means. Yeah, it's secret code, I know. So if you've had it more than a week, if it's something your doctor routinely treats you for, go to your doctor. Make an appointment. If it's something that can wait until morning, not that you want to wait until morning, this has nothing to do with that. If it can wait, if you're not going to die, if you can control the pain with Motrin until morning, if you can control the fever and your baby falls asleep, don't wake the baby up and take him to urgent care. Wait till morning and call your doctor. That makes a lot more sense. So, in terms of the emergency room, your copay is way higher for the emergency room. So I would try to avoid that unless you're really sure you need to be there. For some insurance plans, urgent care has a higher copay than your doctor's office, others don't. But what happens when you go to urgent care is that I never see those records. And sometimes we start missing things. I've had kids who've gotten 5-6 ear infections in a year, and I never knew, because every time they got the infection, their mom would take them to the urgent care and wouldn't bring them back to us. Well, that kid needed surgery, but urgent care is not going to address that because that's not their role. Their role is to not let you die until you can come see me. Okay, that's the goal here. So there's been some stuff in the news about, or sort of in medical news, about the millennial generation overusing urgent care. So for the record, I don't think that's real. Millennials happen to be parents at a time when urgent cares are readily available. I think that if my parents had had that resource, they would have used it. So I don't think it's generational, but I think it's human. Look, we know we have a delay of gratification problem in the United States. We all know this. It exists here too. Just because it's inconvenient to wait for a doctor's appointment doesn't make it okay to go to urgent care for every little thing. I'm sorry. I know waiting 3 days to see your doctor is a pain in the butt. But it is the way that medicine really is best practiced. And if you want good medical care, you need a primary care doctor. You just do. Having said that, real talk, I know that there are doctors in El Paso where if you go in to see them, particularly some pediatricians, who if you go in to see them, you may sit in their waiting room for 4 to 8 hours before you get seen. Okay, y'all, that is not acceptable. That is not how I work, which I think some of you have already figured that part out. But that's not what we do. If that is your doctor's situation, the fact is that they are over-empaneled. They have too many patients in their practice for them to take good care of all of them. Likely you're getting short visits. Likely you're not going to meet with the same provider every time. You're literally essentially in an emergency room. You're in an urgent care waiting room, because how are you possibly getting good care if you're waiting that long and then having a 5-minute visit with a doctor? You're not. They may be wonderful people, they may be great doctors, but this is not an okay way to treat patients. If you are sitting in that waiting room for 8 hours, that is not normal. That is not appropriate office function. Find a new doctor. Seriously, find a new doctor. Because you deserve a doctor that when you call them, they can get you in within 24 to 48 hours. You deserve that. And if that's not what you're getting from your doctor, find a new one. Doctors' offices will update their function only when it benefits them. And it will start benefiting when they start losing patients. It's just how it works, right? Incentives work. And if they can over-recruit and make more money, they will. We're people too. Sometimes these things happen. But you deserve better care than that. Go see your primary care doctor. If you need an emergency room, please go. But if you've ever wondered why you sit there and wait 8 hours, it's probably because you're not sick enough to be there. And your care might have been better given to you faster in another location. If you have questions about where to go for care, call your doctor's office and ask their advice. Because most doctor's offices have an overnight nursing line or a doc on call or something who can direct you a little bit better. Is this an urgent care thing or is this an emergency room thing? Or can I get in tomorrow to get seen, and does that seem safe and reasonable? Because that will save you a lot of time and frankly a lot of money, and you won't go crazy and get flu or God knows what else sitting in the emergency room. I hope everybody has a good week. I am going to go hopefully get a new glasses prescription. I think I'm okay, but after I had kids my eyes went all to crap, so who knows what's going to happen. And I hope I'm not getting dilated today. I just thought of that. No fun. So I will talk to you all later. Let me know if there's something you want to talk specifically about. Otherwise, something will happen in the next week that gives me some brilliant inspiration. I'll talk to you guys later. Bye.